So good morning, good afternoon, and also good evening, depending on where you are, to all the participants that are joining us today from across the Africa continent as well as beyond. On behalf of the CDC, Africa Center for Disease Control and Prevention, and the African Society for Laboratory Medicine, ASLM, it is indeed my pleasure to welcome you to this special webinar where we are launching the framework for GIS mapping of laboratory systems and networks capacity in the continent. So before I begin, just some logistical updates. There is interpretation that is available, so you can choose to follow us in English, Portuguese, or French. And at the bottom of your screen, you would find an icon written interpretation, and you can choose the most comfortable language that you like to follow us. As well, during the course of the presentations and remarks, if you have any questions or comments, you can also drop these in the chat. And during the question and answer session at the end, we'll be able to discuss those. So today marks a very important step in our collective effort as the region and beyond to build resilient lab systems that safeguard Africa's health in the continent. The framework that we are launching today really represents, I think, a culmination of many years of collaboration between Africa CDC, ASLM, member states, and many regional experts and other global partners in Africa and beyond on how we can provide a unified approach to mapping, to analyzing, as well as optimizing lab capacities across the continent. This framework that we are launching today really embodies our shared commitment to data-driven decision-making, which is very important, and also us working towards stronger networks and ensuring that there's also equitable access to diagnostic services, particularly under the One Health concept. So today, allow me to highlight the key objectives of our launch today. Firstly, it is of course to introduce the framework, presenting its structure, the goals, as well as practical guidance for implementing this GIS lab mapping among the member states. Secondly, we'll also show its strategic relevance, demonstrating how this framework supports our national efforts, our regional efforts, and continental health security priorities, which are around the areas of early detection, preparedness, and response to public health threats. And of course, we have the opportunity of presenters who will share country experiences, offering insights from the member states in implementation level, how they've implemented the GIS lab mapping and how it has been useful in informing them as well as others on best practices, as well as the lessons that they have learned they will share with us. Of course, as part of this, we are also mobilizing policymakers, technical experts, and partners to align our efforts into a standardized format and framework of collecting information that's necessary and for decision making in as far as understanding our lab systems and networks. So how can we align our efforts and resources in advancing this initiative? And of course, during the question and answer session, we can discuss the way forward, where from here, in as far as implementation of this GIS lab mapping strategy. So this framework we are launching really also consolidates the experience we've had since 2018 when the lab mapping initiative was launched, and it puts together that standardized approach, that standardized methodology, the governance structure, as well as data use, whilst ensuring that lab mapping becomes an integral part of our health planning. And I think the most important message we want to deliver today is that data must lead to action. That is transforming evidence into policy and also transforming policy into measurable impact on people's lives. So as we begin our session, I would like to invite you to participate actively in the chat box and share any experiences, questions that you might have as we go through the session. Now it is my honor to invite Mr. Nqobile Ndlovu, the Chief Executive Officer of the African Society for Laboratory Medicine, to deliver his welcome remarks. Over to you, Mr. Ndlovu, to welcome us to the meeting.
So colleagues, ladies and gentlemen, good morning or good afternoon, depending on where you are. So it is my great pleasure and my honor today to welcome you to this very important webinar where we are launching and also disseminating the framework for GIS mapping of lab systems and networks in Africa. This is a very important initiative for us as a continent, especially given where we are in terms of lab strengthening and also even in terms of funding situations globally and also even in the continent. As I reflected today on this launch, I think to me, what is striking me is an area where we need to answer this one big question, and which I believe is the reason why we are having this framework today. And the question is, how can we improve as a continent what we do not know? And how can we close the diagnostic gap for a continent like Africa, where we know that the statistics are saying over 80% of our populations that do not have access or they have little access to diagnostics? How can we understand that gap? How can we close that gap when we do not know what tests are done at what level, who is doing what, and what communities are being served, and which ones are not being served optimally? So today, this is a big milestone for us as a continent in terms of really understanding the laboratory capacities that exist in our continent, so that we are able to optimize what we have to serve the communities in our continent. So this is very important and very close to ASLM because it aligns very well in the work that we do and the change that we want to bring to the continent. And there are three things that ASLM is really passionate about. Number one is to ensure that populations have access to quality diagnostics. Number two, it's about improving the efficiency of laboratory systems and networks. And lastly, it's about empowering the laboratory community. And when we are able to map, when we are able to have all this data empowers us as a continent to begin to make informed decisions. So we are very excited with this launch today because we believe strongly that when we have this data, it will enable us to make decisions that are well informed for public health response, for infrastructure planning, and also for network optimization. And I'm very proud that this initiative is led or is implemented in partnership with Africa CDC. I want to recognize the leadership of Africa CDC and the presence of Yenew today in this meeting. I just want to also present just briefly the progress that we've made as a continent in some countries, just to touch a few countries. Currently, as we stand, we have over 5,000 laboratories that have been mapped in the continent across 29 countries. And I think this is good news for the continent in terms of understanding our capacity, understanding what platforms exist, understanding what tests are being done and not being done, so that as we plan to improve access to diagnostics, we are guided by data. And I think the important message for us as we launch this framework is that as a continent and as member states, we want to make sure that the data we are analyzing is current, it's real data, so that our decisions are informed by the data that is obtaining on the ground. We have trained almost over, close to 400 data collectors, and this data has been used in a number of ways in these many countries. Number one, it has been used to inform national strategic plans. It has been used for disease surveillance, and also even to design, sample transport logistics. And of course, we are very familiar with the program on diagnostic network optimization. And of course, again, the National Essential Diagnostic List development by many countries. So this is how this information has been helping us as a continent. So as ASLM, We are very excited. We are very proud that we are launching this framework for the continent. And we want to encourage countries, we want to encourage even partners to participate so that moving forward, we are making data-driven decisions. We are guided by what is obtaining on the ground. We are able to optimize even the little resources that we have as a continent. So I want to stop here and hand it back to you, and looking forward to exciting presentations and also exciting discussions. Thank you so much, and back to you, Dr. Talkmore.
Thank you very much, Mr. Ndlovu, for those very warm remarks to welcome us to this very important launch. And you have highlighted, I think, some of the key achievements that we have had already in the continent, particularly how this relates to some of the key priorities at ASLM, which is around ensuring the populations have access to quality diagnostics, improving efficiencies, and also empowering the lab community by ensuring that there is data that we have which can be used for decision making. And already, the little that we have already done as far as mapping is concerned, shown by the numbers we have shared, it has already been used in very important programs like the diagnostic network optimization, development of essential diagnostic lists, amongst others. So we are excited that as ASLM, you are also part of this initiative to ensure that the correct data is available for making the right decisions. At this moment, let me welcome Dr. Yenew, who is the Acting Director for Laboratory Networks and Systems at the Africa Centers for Disease and Control, who is going to officially open this meeting on behalf of Africa CDC. Dr. Yenew, over to you.
Thank you, Talkmore. Thanks, Ndlovu, for those very important remarks, which are really, the core points in terms of the overall objective of developing this document. I really appreciate. Greetings, colleagues who are on this platform. So as Ndlovu and also Talkmore mentioned, I think the laboratory service area is very dynamic. We know, the service is expanding. We also know that some of the labs which were established during emergencies, some of those are decommissioned. And we also know that, we are advancing laboratory capabilities, including establishment of high technology laboratories like genome sequencing and so on. Those are happening across the African continent. But the challenge is, at country level, we may not have that up-to-date information in terms of data, including, your equipment footprint analysis. So this information on the lab mapping and the equipment footprint is very critical. Number one, as Mr. Ndlovu mentioned, it will be key in terms of to see how, you are doing in terms of population coverage for your lab services, both geography and population coverage. Number two is if Ministries of Health, they do have this information at hand, it will be easier for them to upgrade lab services, to expand laboratory services, and then also to plan for human resources. And the third important point is we need to optimize our laboratory network, especially in this era where we are operating on a reduced budget because of international funding cut. We need to establish our laboratories in such a way that they are optimized, and our specimen referral network should be informed by such kind of data. We know in many countries, the specimen referral network follows administrative boundary, which may not be cost effective, but the lab mapping data will give you the opportunity to set up your specimen referral network based on geographic proximity so that you reduce the cost. And then finally, this kind of information, the data will help you to integrate laboratory services. A good example is in DRC. During the Mpox response, we used the GeneXpert footprint analysis from the laboratory mapping process to set up COVID Mpox testing. So this is very, very key. So as Ndlovu mentioned, more than 5,000 labs have been mapped. So this program was there led by ASLM since 2018. I know, there are a number of progresses, including country-level capacity building, and training of people and deployment of tools, data analytics, and so on. However, the program faced four main challenges. Number one is it was resource intensive, and it was very difficult to reach all laboratories. Especially if you go to peripherals, there are too many labs, and it will be very difficult for you to go into each of the labs and do geospatial mapping of laboratories. The second challenge was the process was not fully owned by countries. There has been a number of capacity building activities at country level, but this was not really driven by Ministries of Health. This was mostly supported by partners. That ownership and putting the lab mapping as a main strategy in the National Laboratory Strategic Plan and so on, it has not been there. The third challenge was lab mapping is not one-time exercise. So if you do once, it doesn't mean that you completed the exercise. So it has to be iterative. It has to be updated every time as things change. So I think we are not really on top of doing updating once the lab mapping is completed. And of course, the fourth one has been there is limitation in terms of implementation of the data for decision making and policy decisions and so on. So the objective of this, the framework that we work with is ASLM and member states and some partners, is actually to shape the laboratory mapping process in a very structured way, and then to make sure that the process is owned by countries. That's why if you go to the document, there are proposed structures, coordination structures at country level, at regional level, and so on. There are resource mobilization schemes. The strategic framework also guides you in terms of how do you approach in terms of selecting labs if you want to go to peripheral sites, if you want to do like level 2, level 3, and so on. So what will be the approach and so on. So it's really a very helpful tool, and I really appreciate this occasion today where we had the opportunity to officially disseminate this important document. So as Africa CDC, so we are very much committed to work with all of you to implement this framework. As I said, the framework is more resource intensive, and we need to work together as member states, as partners, to push this agenda forward. It's really a very powerful tool, and having that kind of data with a single click at Ministry of Health, it really empowers all of you to improve your laboratory service. So I look forward to implement this strategy. And as Africa CDC, we will be reaching out to each one of you as we continue implementing this program. Thank you very much.
Thank you very much, Dr. Yen, for these very insightful remarks. I think you really outlined the scope as well as the rationale for this very important framework, in really that it's really trying to address some of the key challenges that we've had when it comes to strengthening our lab systems and network. And you pointed out, I think, four main of these around the issues of resources, it being very resource intensive, lack of country ownership, also it being a very continuous process that needs to be continuously updated, and also how we can ensure that there is more uptake and commitment from member states as far as ownership is concerned. And really the framework, as you put it rightly, it tries to address that by defining and also outlining how we can address these four challenges. And thank you for the commitment that Africa CDC has reiterated today, has always done, and will continue to do into the future. And you called upon member states that we need to come together, particularly in these times of changes in the funding landscape, where more and more will be required from the countries to support initiatives in the continent, including this GIS lab mapping. So thank you very much for those remarks. This really sets the tone for our next session, where now we'll receive a presentation on the overview of the GIS lab map framework. And to do that is Yao Selom Atrah, who is the senior officer within the division of lab systems and networks at the Africa CDC. Yao Selom, the floor is yours. Thank you.
Thank you, Dr. Talkmore. I hope you can hear me. I'll present on behalf of Yao, who is facing network challenges. Thank you. So what's in this document in presentation is only what is in the strategic framework. So you can see this is how the page looks like, the starting page. We'll cover the background and rationale. Some of it has already been covered, so I will not dwell a lot, but also focus on the approach, but also the key findings that informed the development of the strategic framework, the goals and objectives, then the phases of implementing for LabMap, but also the governance and coordination, also monitoring and evaluation. Then the last one will be next steps. When you look at the framework, it has key things: introduction, you find goals and objectives. You also find how to establish the program itself. Establishing at country level, how do you go about it? But it also, number 4, it also guide you on data collectors training and also data collection. Number 5, it also guides you on data validation, analysis, and utilization. Then there's an expanded list on the use cases. What can you apply in terms of use cases? Some of it have already been mentioned. Section number 7 talks about governance and coordination at continental level and also national level, but also resource mobilization and sustainability, then monitoring and evaluation. Then on the annexes, you only have the key tools that should help you to operationalize the framework. So when you look at, as mentioned by the CEO, Mr. Ziov, and also Dr. Yenew, you can see the justification. I will not go through that, but we have a link on the Africa CDC website. You can see that LabMap is already on the website, so you can download from there. It supports One Health approach, that's the key, but also it aligns with the international regulations, HR 205. And it focuses the impact that it brings in surveillance and lab systems, but also in SS coordinations and also to support the priority diseases for Africa CDC. In terms of approach, we had several regional consultations face-to-face, one in Tunis for technical experts that brought in the North Africa region. We also had one in Accra that brought in the experts from different countries that experience LabMap, and also Abelon, where a team, experts from IT, ranging from data experts, and also the program side, also started to review what the meeting in Tunis and Accra came up with. Then in Nairobi, there was director level, which validated the findings and developed the strategic framework. Then we also did program review. What have we achieved? And also what are the key gaps, 2018-2024? As you can see, the member states that participated, Africa CDC and ASLM, and in total about 109 people were part of this movement. You can see the people that joined in Kenya, that's the team, and the team of directors. Then we go to what was the findings. In terms of findings, we know it started in 2018 by GIS Foundation, focusing on Niger and also Ethiopia, mapping about 461 labs. Then over time, we developed the portal, but also we also developed the standard operating procedures to guide in terms of how do you engage, but also management. But now, as mentioned, we have reached 27 countries, but there's also a web-based training materials. That's what the review found. But also some dashboards has also been developed. In terms of key gaps that we identified, the review team identified that there was no strategic framework to guide the countries, but also there's underrepresentation from the animal and environmental health at country, but also at continental level. But also it was resource heavy, and therefore the funds were inadequate, wasted, and more is being worsened by the changing landscape. It was also noted that there is weak advocacy and also unstandardized or coordinated data collection. Different countries, some countries are using different tools. Therefore, if we need to move in a collective way. But also the updating of timelines, when do you update the next one? But also the sharing across the One Health, but also the analysis skills. One other key issue across all the continent was the privacy and interoperability of the data systems. So the privacy, because of the laws in different countries, and LabMap comes into affect it. Therefore, it was decided that the goal should be to sustain and optimize laboratory information sharing systems using GIS LabMap for effective and efficient clinical and public laboratory services for early disease detection and surveillance of public health threats in Africa. You can see the keywords: sustain, but also optimize. And also the focus on early disease detection, but also the surveillance aspect, but using evidence from LabMap. In terms of strategic objectives, it was decided that we should expand geospatial mapping of laboratory capacity in all AU member states, about 55. Remember, we mentioned about 27, but all these member states are 29. All these member states, they are supposed to have LabMap. The second objective was to increase utilization of mapping data that inform diagnostic capacity improvement across Africa. In terms of phases, how do we achieve those strategic objectives and the goal? It was decided that one, we must have, the first phase should be data collection and integration. That includes stakeholders' engagement. The integration was to address where countries were not accessing data directly, and also the issues of privacy and interoperability. Then the second phase was data analysis and utilization to ensure that use cases are implemented and add value to the program. The third phase, as mentioned, was to go beyond just data collection, but to implement what are the findings from the data that you have and also monitor the work plans. The fourth phase was to resource mobilization and sustainability to ensure that the whole process is sustainability is mainstreamed from data collection, from data analysis and utilization, but also through implementation. In terms of phase one, the first part is the stakeholders engagement. And here the National One Health Technical Working Group was found to be critical. There must be a commitment for high-level team at the country member state level. And you can see who is supposed to be there. All the One Health people needs to be part of that high-level stakeholder engagement. The second part is data sharing agreements. How do we ensure that the people that support the program are also able to support in terms of analysis, but also use data to inform activities? So there must be data sharing agreements. But also, how do we strengthen the structure that we have at African CDC, at coordination level, at national level? So establishing this multi-sectoral coordinating committee to oversee implementation at national level was found to be very critical instead of having one sector that is running LabMap. Then also on day-to-day basis, at least 3 people that are a core team, focal person, data expert, and HIS expert to lead the process. Then also it sorted out the selection of the labs. How do you select those labs? And the team decided to use the WHO tier classification, which is primary, secondary, and tertiary, and also use a sampling models. In case you have a lot of money, you can map all the labs. So the sampling model just tells you when you don't have enough resources, do a sampling, but you still achieve the same. In terms of data collection and training methods, the same phase one, it suggested the framework says you can have a physical training that should last for 3 days, theoretical and practical, but also it brings in the remote training that we can do in 5 days. And we hear from Cameroon and Tunisia how they've done that. It also talks about also going further, that you do the external assessment and also the self-assessments. So self-assessments where a lab person at that site in different countries, if he's trained using virtual, but also the team on the ground, should be able to submit the data the same way we submit data in GIS2 by the site itself. When you look at the sampling methods, it says at tertiary level, we should map all the labs because they're critical for priority diseases. At secondary level, we should have, if we have less than 100 secondary level laboratory, we map all the laboratories. But if we have above 100 to 200, we should do at 70. If we have above 200 to 500, we should do at 60. If we have above 500, we should do 400. That means you are mapping the tertiary, you're also mapping the secondary, you're also mapping the primary. That is in the context where you don't have enough resources, but it should also help you to make a decision. So this sampling method, you can make a decision without mapping all of them. But all these, they go together. The primary level goes the same way as the secondary level. When we go to phase 2, the data systems is collected using standardized form and transmitted in real time to the African CDC repositories. But when you look at the data integration, also the private that was mentioned, is supposed to be integrated with the country level systems. But also it also provides for a country to create their own systems, and the data agreements that we talked about should be able to inform Africa CDC and its partners like ASLM. So it has provided for all those options. When we go, so you can see the data moves from the tablet, and the standardized form is in the tablet and goes to Africa CDC, but it can also go to the country or integrated in the validation and supports the data analysis. That's the visual. You can see the areas collected, profile, infrastructure, test menu, supply chain, major equipment, by safety, network linkages, and all these aspects that are collected in the form. So the form is quite rich and it activates. So it starts with the form, with all this information and transmitted online and real time. When we go to phase 2, which is utilization, we're talking about first we start with validation, where you can use a mix of approaches, virtual and physical. I know Cameroon have used that. Then every one person from the One Health should be part of cleaning the data because their labs are there. So they need to be part of that cleaning of the data. Then in terms of when you clean the data, you need to identify the use cases because those are the ones that you're going to inform and analyze the data and inform what you're looking for. So the first part, the strategic framework identify the policy development, where translating data to policy that informs strategic plans and national diagnostic lists, but you can also use for grants proposal. You can also use for advocates, for resource allocation. You can also use for surveillance integration, but you can also use the data for diagnostic network optimization and also sample transport planning. On the same utilization, in terms of analysis, I mentioned about the key issues regarding data analysis and also sharing. The dashboard was identified as a key aspect, especially the live dashboard, because it will cut across the One Health instead of data sitting with a data expert, and people don't share even at a country. So the dashboard was identified as a key thing and has been mentioned there. And also other analysis that can be added apart from the dashboard so that when you get the data, the analysis are done quickly and the leadership is able to see across One Health, and the national One Health TWG is able to use the dashboard to know where capacities are. Then from there, you also do the gap analysis. That's the second part, where you compare your current status to your policy standards, such as the national essential diagnostic risks, and also strategic plans where you have targets. So if you have biosafety level 3, what was your target? Then you compare, that should give you a gap. Then on same utilization, supposed to develop capacity strengthening work plans. You have identified the gaps. You know your gaps, then develop your capacity strengthening work plans with different resources and also the timelines. Then the fourth part is to publish the report, because without a report, people are not going to know what you found. Therefore, it has indicated that there should be a report at the end. So a report and a dashboard, they go together to ensure that the report is shared to all national stakeholders. That include the capacity strengthening plans. Then in terms of data updating, a new country should begin with external assessments. So if you are a new country, start with external assessment, followed by self-assessments. Then monitoring occurs at continental. Remember the governance structures, and also national level, we have structures there. So you can see the first part is a baseline. As a new country, they felt that collecting the externally at first is good, because you also get quantitative issues. Then the second and the third here should be self-assessment. The first and the second self-assessment. The third should be external, because when you have a strategic plan, laboratory strategic plan, or one health strategic plan, obviously in the third year, you need to do a mid-year review. Therefore, you need to go in the field and collect data and also observe what is on the ground. But remember, I mentioned about weak advocacy. Therefore, it's important to have a communication plan, and member states should leverage national platform to advocate for staff and funding. This is one area. In terms of phase 3, it talks about those capacity strengthening plan that has been converted to a laboratory strategic plan or one strategic plan. They need to be implemented. So when you have a capacity strengthening plan, they should be embedded in the laboratory strategic plan, and they need to be implemented as one. Then you have to update the data set annually, but also monitor and review the KPIs and incorporate updates into the program. In terms of resource mobilization and sustainability, a number of strategies were identified. One, advocacy led by Africa CDC and ASLM to prioritize and allocate funding at national level, talking to countries, but also integration into plans such as laboratory strategic plans, because if it's there, it's going to be marketed as the national strategic plans, and donors should be able to consider that. Then also adding value where you have capacity strengthening based on the areas you want to focus. Then also funding sources, engaging potential funders, mapping those funders so that we can send the concept note. So you can see that's why there is a concept note, standardized concept notes 4 and 5, they go together. So there is a concept note that the country is supposed to use to actualize and send to the donors. In terms of sustainabilities, the virtual learning platforms that Cameroon used and is going to demonstrate that there, and others you have seen Find Academy to reduce the costs, but also define the laws for the core team, but also the national One Health TWG is important, and advocates through TWGs, infrastructure support like building system for data collection at national level is also part of sustainability, but also institutionalizing into the One Health TWGs, NPHIs, and also strategic plans that will make it to continuously be implemented. So the team also looks, the strategic frame also provide averages in terms of cost. It takes about 55 to 75, depending on the country, to do lab mapping. You can see it's expensive. If you do 20, that would be a lot, just data collection. But it also, for the workshop, data utilization, but also capacity strengthening, about 300. But money should be moving to capacity strengthening. The second model is the remote self-assessment model. This one, if you cut the data collection, physical, you only spend on bundles, but the rest of the funding goes to utilization and capacity strength and implementing the strengthening plan, capacity strengthening plan. So you can see it drastically moves from data collection heavy to implementation and also to policies. So this is what the strategic framework is trying to achieve in terms of reducing the cost, sustaining the program, and moving more to remote using the academy, but also the self-assessment where a lab person should be able to send the data provided is trained. When we go to governance and coordination, it suggests it starts with Africa CDC, but also we know Africa CDC has a key existing, it leverages existing structures like the Africa Laboratory Technical Working Group. This is already existence. It created a laboratory systems and network steering group that should comprise directors at country level to be able to, at continental level, but directors from different countries to be part of that so that they fit into the Africa Laboratory Technical Working Group. Then it liaises with the National One Health Laboratory team, coordinated by NPHI, but any department. But also development partners are involved. So you can see the key structures of the Africa Laboratory Technical Working Group and the National One Health Laboratory team, coordinated by Laboratory Systems and Network Steering Group. In terms of monitoring as a strategy, we are talking about objective 1, number of AU member states with multi-laboratory capacities. And you can see when you go to increase data utilization, it talks about number of member states implementing LabMap use cases to address capacity gaps, but also member states that have dashboard visualization portals. In that way, it means you're pushing more into use and adding value. In terms of next steps, some of those have been mentioned. I'm just trying to add more. One is to finalize the standardized data collection tool to reflect the One Health. Remember, it talked about underrepresented. Therefore, the tool was supposed to be revised, and the revision process already started, is being finalized currently. Then also operationalize the continental and national structures. You can see we have a structures that have just been created. Others, maybe they're not discussing LabMap, but in this case, they need to be operationalized. Then also develop and distribute guidance materials and toolkits to assist member states. Then also strengthen the platform continuous training and collaboration and exchange of information from LabMap. If you have information and you don't have a platform for continuous training, the information will just be in a laptop. Then also strengthen the live dashboard integration. This process started, but it needs to be strengthened, especially the live dashboard that looks at both to support the laboratory-based surveillance system. Then also partner engagements, mobilizing resources to ensure that we have money for the implementation. Acknowledgements, would like to acknowledge the member states that joined and produced this document, but also would like to acknowledge Africa CDC for providing the resources and the technical support, not forgetting ASLM for the support technically, but also for the funding. This is the framework, and over to the moderator. Thank you.
Thank you very much, Tapson, for standing in for our invited speaker today. Apologies for that glitch on their part on the connectivity. But thank you for taking us through the highlights of the GIS lab mapping framework, really taking us through the process, the consultative process that was followed to develop this framework based on the initial data that was collected from those 5,000 plus labs that were mapped, and also the steps that were taken to engage member states, to engage key stakeholders as well as experts in the region and beyond to come up with this framework. You also really outlined the key gaps that were identified that also formed part of the rationale for coming up with this framework. One of which is that there was no really regional strategic guidance that was there on how we can all do collect information about our lab systems and networks in a standardized manner that also allows us to make comparisons and learn from each other across the continent. And I think you were very clear in terms of the goal of this framework. We're highlighting two main words, action word that comes from its goal statement, which is sustain as well as optimizing. So we need an approach that's sustainable. And secondly, we need to make sure that the data that we collect is data that allows us to optimize our laboratory systems and networks, given the challenging resource limited environment that we are operating. And I think the strategic objectives were also very clear in terms of what are the key thematic areas that came out of your scope of your SWOT analysis, the emerging themes, the priorities, and also a list of the interventions that will be implemented. Thank you for taking us through the phases for the framework, beginning from the inception phase, which is phase one. How do you establish this at country level, the program for lab mapping, which includes your data collection and integration. Phase two, where you now utilize the data that you have collected, which is steps that include validation, analysis of the data, and most importantly, as you highlighted, generating a report that can then be made available to the stakeholders in the form of reports or dashboards that are housed at Ministry of level. The third phase being implementation and monitoring. So it's no use to just collecting the data, but we need to ensure that we transform that data into action by making sure that the data informs our decision making. So the framework describes how the analysis can be done. It also describes what are the potential areas that this data and information can be used. Our countries are involved in budgeting processes. Our countries are involved, for example, in global fund applications, submissions to different development partners. There's need for information on where you are in terms of capacity of your network and systems. And this information from lab mapping becomes very crucial and central to that. And of course, you also highlighted something very important, the governance structure, both at continental level, as well as how that can be mirrored and mimicked at national level to ensure that there's proper coordination in a structured way to implementing the GIS lab mapping. Lastly, you then highlighted the next steps. Where from here? You indicated you will soon be finalizing some of the data collections too, actualizing the governance and coordination structures, mobilizing and coordinating technical assistance that will be needed to countries in terms of training, data collection, analysis, report generation, and also how to utilize the data for different reasons. And of course, very importantly, also establishing a platform where countries can continue to share information, share lessons learned in the form of a community of practice. And of course, making sure that the dashboards are live and available to member states as well as at regional level. So thank you very much for outlining this. And colleagues, I saw that a link has already been posted onto this framework. Please open it, download it, and after this meeting, you can have time to look at it. And if there are questions, please send them to the Africa CDC and ASLM teams for assistance. Of course, more will be coming in terms of the next steps that Tapson has outlined. So we've heard from Tapson on the framework itself. And in his presentation, he spoke about some countries that have already started implementing some of the guidance and steps that are outlined in this framework. So we are honored to have someone who, or a country that has really been implementing and trying out this GIS lab mapping. And we are going to receive some updates and also a demonstration on how they've implemented the GIS lab mapping, whether it has been useful, how it has been useful, and also maybe if there are challenges that they faced how they've managed to circumvent this. So I would like to invite Miss Elizabeth Pedom Mofola, who is the head of the laboratory unit in the Department of Laboratory Services in the Ministry of Health, Cameroon. Madam Elizabeth, the floor is yours to give us an update of the implementation of this framework and GIS lab mapping in Cameroon. The floor is yours, madam.
Thank you, Dr. Talkmore. Good afternoon, everyone. I'm going to present the different the lesson learned from our lab map, highlighting the gaps in diagnosis. My presentation will be in English, but I'm going to do it in French. So I don't, okay, thank you. Donc, le Cameroun est un pays
So Cameroon is a country that is located in Central Africa. It is a country that basically borders to the north Chad, to the east Central African Republic, and to the south by Congo, Gabon, and Equatorial Guinea, and to the west by Nigeria. So the population is around 30 million. So we have 30 million inhabitants. And with regards to our sanitary training, according to our last mapping that was done by the sanitary informations team, was that we had around 6,677 health facilities, each with a lab with laboratory infrastructure. So we had 20 health facilities of level 4 and 24 health facilities of level 3. Now, again, we have, so in terms of the 20 and 24, these are trainings that are held. Now, with regards to the mapping and IP support sites, they constitute around 10% of these health facilities, and we also say that the trainings were done also and supported by the different partners represented. They represent around 50% of the trainings that were done, and they helped with that. Now, with the goals and objectives, we can say with our journey to sustainable GIS laboratory mapping, we can say that in 2018, we started our first phase, and we had around 13 laboratories mapped. Now, these 13 laboratories were only laboratories that were, I would say, reference level laboratories, and we could use the training models with regards to the practical training models, as well as the collecting of data. We were able to at least experiment in that phase. Now, for the in 2019, we had a continuation of phase 1 where we scaled up our mapping. We had 155 laboratories mapped, and we carried out our physical training and data collection there as well. Now, we scaled up again in 2020 with the mapping of laboratories. We had then 360 laboratories mapped, and of course, we continued our physical training and data collection. Now, phase 2 came around finally in 2025 with 548 laboratories mapped using the hybrid model of training, of virtual training and physical data collection as well. So on site, in other words. Now, with regards to the funding for the second round of our mapping in 2025, we needed to obviously make a call to the international funding, so global fund request, in other words, to MOH to submit priority areas for funding. Now, the lab map was identified as a key domain or key area that we needed to work on, and now, however, with the funds that were not adequate to complete the mapping of our sites, we had some challenges. Now, we engaged several other partners and donors, such as ASLM, and that allowed us to receive support from ASLM, from GIS, IPGO, and the government to have co-investment. Now, the funding supported trainings, field data collection, data utilization, and strategic planning. Now, the analysis of these data as well was done, and we equally were able to move forward with the elaboration of our national strategic plan for our laboratories. Now, for the different phases that were proposed in the framework of the laboratory mapping, we had our first phase, which of course was linked to data collection training and data collection as well. Now, we were able to get financing from ASLM as well as from the Global Fund. And for everything that was second phase, we had we conducted our data validation, analysis, and utilization. We got our funding from GHI, PIGO, GF, and ASLM. And then for phase 3, we are going to do the implementation and sustainability for phase 4. Now, those are the subjects we'll be focusing on. Now, how did we actually test our training models that were proposed by ASLM? We can to expand mapping coverage. Now, we can say that we identified with the different leaders that we had working on it in Cameroon, we were able to identify data collectors with experience in laboratory medicine in 10 regions. We had also, we had our first phase and second phase, first phase mostly of our laboratory mapping. We started in 2018 to 2020. And we were able to walk through the ASLM Academy with data collectors to be able to get the training online as well. And all the data collectors were based at their sites. We enrolled in the data collectors into the ASLM Academy into French and English as well, into the different modules that they had. The data collectors were self-trained using the modules in the academy for 3 to 4 weeks. And each collector that completed the test, a test of every module, and each data collector that piloted the data collection tool, we had a great pass rate there. Now, we had at the start 41 people that were enrolled. Now, 6 of those trainees dropped. So the number the number of people that completed the training was 35, and the number who passed was at least 75% out of that 41. So we're very happy with that. Now, with regards to the feedback from collectors, we had the online training. So how would you rate the overall effectiveness of the online course in preparing your data collection and mapping labs in your country? That is the question that we tried to answer. We had a couple different levels of people that were judging the fact that it might be or might not be effective.
We kind of lost her there. We can't hear her. Her sound is not good. I can't hear her. I'm sorry. I can't hear her voice. She's gone.
Yes, I think we have lost the connection. We'll just give a minute to try and reconnect. If not, we'll quickly move to our next presentation. So let's just give it 1 minute.
What are the information on key capacity? And also the capacity strengthening plans.
Please, are you getting me?
Yes, we can hear you now. Please proceed.
Okay, thank you.
So with regards to testing capacity at the level of test menu, we notice that most laboratories do not have a full minimum package of testing services for priority disease surveillance in line with the national list of essential medicines or national norms. And at this level, we formulated some recommendations, including the review of the list and implement the list at all the testing services. We also noticed that there was a siloed laboratory-based surveillance across One Health sectors to detect priority pathogens. We proposed to develop and implement mechanism for information sharing to facilitate the collaboration across different sectors. We also propose to establish an integrated mechanism for sample movement across sector, as well as optimization of route in different sectors. With regards to specimen referral and transportation system, we identified parallel systems in terms of specimen transport, and there was also a lack of specialized tools. So we proposed some recommendations, including assessing our logistics system and also infrastructure and capacity across all levels. We also propose to develop an integrated system that comprises priority diseases. We also propose to develop a costed plan for the operations of the samples, and also to develop and utilize digital tools and platforms for real-time specimen tracking. With regards to HR, human resource, so we managed to find that there was an even distribution of human resources at different levels of laboratories. We proposed to implement strategies to recruit in order to boost representations at different levels of laboratories, also to create clear career advancement pathways. With regards to equipment, we also identified as gaps a routine calibration of pipettes and auxiliary equipment, which were not properly done. So as a recommendation, we propose to increase calibration exercises in two ways: long term, which means building the capacity in terms of calibration, and secondly, short term, having contract services to enhance capacity. With regards to waste management, we noticed that the SOPs for waste management was largely not available, which actually, because there was a poor waste management practices at the laboratories or health facilities. So as recommendations, we propose to ensure 100% of SOPs availability and at the health facilities and laboratories, so that laboratories can have a system of waste elimination, especially liquid waste. With regards to quality management system, 50% of our labs that were in the enrolled in SLMTA's split process, less than 50% were accredited. So we recommended to continue to follow up these laboratories so that they can they can obtain ISO accreditation. We also found that there was inadequate quality management system implementation at different levels of laboratory. So we propose to expand the quality management system adoption and implement it at all levels of laboratory. We also try to do a comparison of capacities between 2020 and 2025. So we notice that there was an increase in terms of molecular diagnosis at the country level for some diseases like Ebola, dengue, rabies, mpox, and anthrax. We also found an introduction between 2020 and 2025 of molecular testing capacity concerning Marburg, and also we also learned that there was an existing sequencing capacity for some sicknesses. However, we identified some gaps, like the Ebola diagnosis, and we only had 5% of laboratories that have Ebola testing capacities, and 16.7% for testing cholera with using PCR, and 11% for testing mpox using PCR, despite the resistance of our national essential diagnosis list that specify that some laboratories should have the capacity. Unfortunately, nothing is done at that level. So how did we use the lab map data to address the gaps? We should say that we used the data of lab map in our laboratory strategic planning, which include TB coverage. We also used in terms of diagnosis optimization for tuberculosis, HIV, and hepatitis, and also to strengthen the priority disease surveillance, identified gaps, and also developed capacities at our national plan. This is also to show you how we can, what are the strategies that we can use as sustainable solutions. We need to do cascade remote or hybrid approaches for training, and self-data assessment at lower levels of laboratory sites to limit the mapping. We need to put in place a national team for coordinating different sectors, institutionalize in the lab map in different structures, such as laboratory TWGS, and lab strategic planning. So also institutionalize this exercise. So here we want to thank the Ministry of Health that helped us in to materialize this exercise at the national level, ASLM for helping us with lab map, Africa CDC Global Funds for the financial support, CDC Cameroon through the Global Health Security Agenda, the also GHP Ego. We also want to thank all the data collectors who helped us to have all the data that we have today and that helped us to do this presentation. Thank you so much.
Merci beaucoup, Madame Elizabeth, for this very comprehensive presentation on your experience, lessons learned in implementing GIS lab mapping in Cameroon. I think, and I'm confident this has been very insightful for those that were following this presentation. And I think some of the key highlights from your presentation is how you manage to mobilize resources from a multiple funding streams. So not only relying from one source, but working with a multiple of organizations, including the government of Cameroon, JPIGO, Africa CDC, ASLM, Global Fund, among others, to mobilize the needed resources to be able to implement this GIS lab mapping. And it took us through a journey from 2018, where you only had about 13 labs mapped, up to 2025, where we are close to 600 labs mapped, which is quite, I think, an achievement. And hopefully this can be accelerated and cascaded across the country based on the lessons that you have learned in this exercise. And you also highlighted, I think, some of the key findings, which I think will also be a lesson for those that are learning as to what sort of information, what sort of insights do come out from this very important exercise of mapping your lab network and systems. You were able to see that most of your facilities did not have the minimum package that is required, or which is in alignment with your national essential diagnostic list. Also, the mapping highlighted how your lab-based surveillance system is very siloed in its approach, how the central referral network system is also fragmented. Again, the mapping highlighted the gaps that are there in as far as specialized tools that are needed for diagnostics, and also the uneven distribution of the human resources across the network. Issues around equipment, service and maintenance, quality management systems, waste management, all these, you were able to pick these from the lab mapping exercise based on the data that you collected and the analysis that you collected. And you also showed how you transitioned from data collection to actual utilization of that data. So the improvements that you implemented based on your findings and interventions that resulted in a number of key notable changes within your system. And you highlighted one of these where you observed an increase in molecular testing, and also the data, how in alignment with the goal of this GIS lab mapping framework, which highlighted two things: sustaining and optimization. Sustaining optimization, where we encourage utilization of the data. You manage to use it in updating your lab strategic plan, diagnose network optimization plans, and also strengthening your priority disease surveillance for your priority diseases in the country. And as far as sustainability is concerned, I think the dual or use of hybrid approaches to training, where people were enrolled into the ASLM Academy, where remote trainings really helped you to cut down significantly and minimize the resources that are there. And of course, the recommendation that there's need to have an in-country GIS core team that will lead and coordinate the implementation of GIS at national level, as is guided in the proposed governance structure in the GIS lab framework. So thank you very much for sharing this experience on how this can be done at national level with such notable interventions that come out of it. So we'd like to look at how this lab mapping. So when you talk about lab mapping, maybe one may think we are talking about the higher labs, your national reference labs, your provincial labs, county labs, whichever structure you have. But can lab mapping also be utilized at lower level laboratories? Because these are part of your network We heard from Cameroon that they discovered that there is a fragmented specimen referral system. And this is really what connects our lower level laboratories where our patients and clients are to maybe other testing different levels where different tests are done within the network. So can lab mapping be useful at lower level? We would like to learn today from Tunisia, and they will talk about how they have expanded lab mapping in their country to lower level laboratories. And to take us through that is Dr. Nadia Belhaj Ama, who is the head of coordination department at Biology Laboratory Unit in the Ministry of Health, Tanzania. Dr. Nadia, the floor is yours, and thank you for making time to share your experience. Over to you.
Thank you, Dr. Maruta. Thank you very much for the LabCoP team for inviting me to be part of this important event dedicated to strengthening regional surveillance. I am pleased to share today Tunisia's young experience actually with the lab mapping project, which was a key initiative aimed at mapping our laboratories, assessing testing capacities, and identifying gaps to enhance the effectiveness and integration of our surveillance system. Very well. So during this presentation, we will try to talk about our experience in lab mapping in Tunisia and to highlight the next steps to expand our lab mapping to lower laboratory levels. So let's start with the introduction. So for Tunisia, we have a backbone form for diagnostics that is holding more than 950 biology laboratories with public sector, including university and hospital labs, regional and local labs, and private sector labs. They are all coordinated by the medical biology laboratory unit, and for the surveillance, which is overseen by the National Observatory for New and Emerging Diseases. Just like so many other regional countries, we have faced COVID-19 recent threats such as COVID-19. We have seasonal influenza, the rising TB, and arboviruses, and we are facing the threat of rising antimicrobial resistance. But we are trying to stay aligned with the regional and global guidelines, such as for priority pathogen with Africa CDC and WHO. So this is the Tunisian laboratory architecture for human health network. As you see, we have the medical biology laboratory units, which is the public health coordinator, with new and emergent disease national observatory for surveillance and primary healthcare directorate for reporting notifiable diseases. And we have 3 to 4 levels of laboratories. We have the national labs for university hospitals that provides advanced microbiology and molecular testing. We have the reference lab that includes BSL-3 Pasteur Institute, the influenza, the National Influenza Center, and specialized reference units. And we have 1 or 2, let's say 2 level labs. We have the regional and the local labs that provide basic bacteriology and parasitology that refer samples or patients to higher level laboratories for confirmation and sequencing. So the human health laboratories are trying to communicate with other laboratories in One Health approach. We have the veterinary labs, vector and entomology units, the hygiene labs that are working on water and food safety, and the academic labs. So for the key insights, I want to emphasize our young journey of LabMap that started from June 2024 when Africa CDC and ASLM held a sensitization meeting in Tunisia among all North Africa countries except Egypt. On March 2025, Tunisia requested Africa CDC for LabMap training, and on May we conducted a regional LabMap training for North Africa, where 5 higher laboratories were mapped with the support of from Africa CDC and ASLM. On June 2025, we have trained 20 assessors in LabMap data collection with a lab mapping of 8 additional mapped laboratories. They were national laboratories, and 3 of them were veterinary laboratories. On July, after that lab mapping, we have reported to His Excellency the Ministry of Health, which approved with the General Director of Health to roll out to other labs. And we have elaborated an assessor guide to harmonize the assessment understanding and conduction, and made up a work plan for mapping expansion. But this work plan still needs to be adopted. On September 2025, we gathered among other countries that have already conducted lab mapping in Addis to review and adopt lab map framework. And the report of that mission was validated by the Ministry to strengthen disease surveillance in Tunisia. So I want to go through the capacity gaps that we were able to highlight from our few lab mapping, the conducted lab mapping. I won't go through all these details, just to highlight few of them. Like for example, for a national laboratory, for a specimen referral, we lack of standardized courier contracts due to absence of national and standardized transport agreements. We have sequencing limited to SARS-CoV-2 and few pathogens due to need of sustained funding for test menu expansion. And we have an official designation of national reference and regional referent labs, even though we know which lab is have the best expertise in each syndromic approach, but we need to have a legal or regulatory framework clarifying mandates. For early warning surveillance function, we need to enhance the data quality and completeness, which is limited due to lack of resources and need for awareness raising to data accuracy. We need to enhance the feedbacks to regions when it comes to event verification and investigations. This is due to limited search capacity. And we still work on manual, with manual data entry, like a paper form declaration. We need to put in place a digital infrastructure. We are working on that right now, but we need to start with the standard data sharing protocols too. For multi-sectoral workforce strategy, we have strategies for enhancing our communication and integration with veterinary and environmental labs, with cross-sector training. Some of the peripheral labs are not rolled by biologists due to limited recruitments. And we have a training opportunity that exists, but not continuously due to lack of training programs and fundings. So Tunisia was going through capacity strengthening activities, such as regulatory framework assessment for the existing texts that are not consolidated, but we are working on that. And we are trying to establish standards for reference lab and public health laboratories for the infrastructure, the HR equipment, etc. We are trying to enhance our capacity for testing with enhancing advanced diagnostics for genomics and AMR. And we have conducted assessment and enforcement of national and regional laboratories by by putting in place suitable equipments and trying to allow HR among these laboratories. For the training and competence transfer, we have conducted several training programs for biosafety and biosecurity, for good laboratory practice, and for quality that were for, let's say, for technical staff and biologists, not only for biologists. For high consequence agent and toxins, we have already validated the guidelines and lists, and I am honored and happy to share the certification of 2 BSL-3 national laboratories as HCAT structure. And for lab mapping, we have conducted geomapping for the laboratory I have already talked about on June 2025. We have the approval for executing the work plan to conduct lab map data collection for the rest of the level. These are few pictures of our happy lab mapping in June 2025. And by this opportunity, I would like to thank really Africa CDC and ASLM team to help us go through this amazing journey. So we have put in place some recommendation for capacity strengthening for the second phase of lab mapping. We want to secure specimen transfer by establishing national protocol for material transferred, ensuring cold chain, biosafety, biosecurity, SOPs, and professional transport service. We need to strengthen the quality control management by encouraging accreditation and putting in place informative and training sessions to have also internal auditors, trained auditors. We need to establish a fully integrated surveillance system by digitalizing and encouraging community-level reporting. Establish and train multi-sectoral rapid response team in all governorates and with One Health approach. And we need to put in place KPIs to monitoring and evaluating surveillance system. So in terms of strategy for expanding to lower level laboratories, we had already, as I said, the approval to expand data collection to secondary and lower labs. We still need to validate the action plan to make it operational. In terms of storage of collected data, that was the main obstacle to going through the expansion of lab mapping. We are happy to announce that the Ministry of Health Data Center is engaged to securing lab collected data within national service. We are working on that, and it will be available very soon. We will need to create a technical working group for lab mapping coordination and advocacy, especially for national and sustainable financement for lab map on-site assessments. But we will need to explore the remote and self-assessment data collection for national and subnational laboratories data collection to overcome funding issues, especially for the laboratories who are conducted by a biologist, to be sure of the accuracy of the data collected. And we count on using the Academy platform to train more regional and site level staff for self-assessment. So to summarize, Tunisia has strong pillars like for international and national regulation. We have a strong coordination with the ULB, with a surveillance governance done by the Observatory and the Prime Health Care Directorate. We have a capacity of genomic and specialized analysis, And we have an AMR network that is for 100% operational. Yet major gaps persist. We need to officialize a reference lab network, training policies, data interoperability, and we still need to have donor engagement and national reforms to ensure sustainability of the lab mapping. The outcomes of the lab mapping should help decision-making within enhancing lab capacities in order to upgrade surveillance strategies. Many thanks to our partners, Africa CDC, ASLM, and national partners for their usual support on implementing LabMap, and looking forward to optimizing and making sustainable the next efforts of maintaining lab mapping as a baseline activity for surveillance. Thank you very much.
Thank you very much, Dr. Nadia. We greatly appreciate you taking time to come and share with us your experience in what you call the Young GIS Lab Mapping initiative in Tunisia. And from what you have shared, this really has gone beyond just being a young program, but fast maturing into an established system. Just again to echo what has been also shared by others before you, lab mapping really helped you to identify key gaps that are there within your network and your systems. And you highlighted these quite elaborately, including some of the areas around lack of standardized courier contracts, which the information you got from the mapping highlighted this. Issues around centralized confirmations of outbreaks, which I think is an area that is very important when it comes to preparedness and response. It also highlighted that a lot of your data is still in manual form, and there's need for maybe digitizing this, and GIS lab mapping can also help you with that. So among as many other gaps, it's good to learn that lab mapping really draws out the capacity gaps as well as areas that require strengthening within your system. We are happy to see that your program is really maturing from when it started. You really showed us how it all began several years ago through the invitation of Africa CDC 2024 and your request for support, which was granted, and the regional training that happened this year around May, and also the number of people that you trained and the capacity that you then conducted thereafter. And thank you for highlighting to us how you are moving into the second phase of your lab mapping exercise. And as you lower to and expand to lower levels, you highlighted the need to create a technical working group for lab mapping. We saw this as a recommendation from the Cameroon team, that they also were recommending establishment of a core GIS lab mapping team. And we are happy to see this being modeled in Tunisia as well in the form of a technical working group. And again, learning from Cameroon, you also, second phase would like to look at the dual model of remote as well as remote training, as well as self-assessment. So thank you very much for sharing this experience. So we have had, I think, the framework itself. We have had the experience from Cameroon. We have the experience from Tunisia. And hopefully this has really highlighted the gist of this framework, what it is, what it seeks to achieve, and of what importance this is to all of us that are here. So at this moment, I would like to invite Madam Nuru to lead us in the official launch of this framework before we start moving in to the closing sessions. As Madam Nuru is coming on, Tapson, Dr. Collins, you can also help to respond to some of the questions that are in the chat. I attempted to respond to some, but you can also continue to do so for those that are dropping questions in the chat. So, Madam, I think there were some questions that were being posted on the chat, which I will also just run through. I think there were questions around whether the presentations made today can be made available. The team from ASLM will send you the recording of this session, and on that link, there will also be downloadable slides that were presented today. There were really other questions in terms of what assistance is available when it comes to implementation and actualization of this GIS lab framework. And yes, Africa CDC and ASLM are here to support you in many different areas, including technical assistance in establishing the GIS lab mapping program in your country, in training and capacity building, data collection, analysis of that data, generation of the reports that are needed, as well as how you can utilize that data in decision making. So these are some of the areas in the assistance that is available from Africa CDC and ASLM. On our end, our role is also to help you in mobilizing resources, but you can also do this at national level, and the technical assistance can be provided from the Secretariat. And I think there were also other questions around the information that can be collected from the GIS lab mapping, just to differentiate from this exercise, not an exercise that gives certificates, for example, to laboratories and institutions, but it's a system that collects data about their capacity. So when it comes to certification of labs, accreditation of labs, as an example, the GIS mapping does not give certificates, but then it tells you how many of your labs that are in your network are certified to WHO SLIPTA, for example, how many of them are accredited, so that you are aware of the level of capacity and quality management system that is within your network. So this does not by itself give certificates, but gives you the status of how things are within your networks. And thanks to the WOW team, they've highlighted that they are planning to do a capacity assessment for West African countries. Again, we are here to collaborate, and we will be making the necessary connection and linkages to our science and innovation team at ASLM and the team at Africa CDC, so that this can be jointly planned. Someone asked what GIS is. This is an acronym that stands for Geographic Information System, which uses coordinates to pinpoint where your laboratories are, such that when you click that coordinate, it gives you all the information that you need about that facility and laboratory. So these are some of the questions and answers that we provided in the chat, and my team will continue to provide additional. Madam Nuru, are we ready?
Thank you, Dr. Talkmore. So for this official launch, as per the program, we would like to invite Dr. Yenew just to give some words to officiate.
Thank you very much. I'll invite Mr. Ndlovu. Dr. Yenew has stepped out for a moment. Mr. Ndlovu, over to you.
So thank you so much, colleagues. I think this has been a very informative session and a big milestone for us as a continent. So we are very excited to be launching this framework today. So I want to really congratulate Africa CDC for your leadership. And also I want to congratulate even the member states. You have been very instrumental. You have been very key right from the beginning. We can see some of the numbers, some of the labs that have been mapped in many countries. So we really want to really appreciate that. And we are so proud to see member countries really stepping in to take ownership and lead in this very important program. So I always hear this saying that says everything hinges on data. And I think that is quite applicable even to this particular program in terms of guiding our decision making. So I want to congratulate everyone as we launch our framework today. So this framework is officially launched, and we want to celebrate and thank everyone for your inputs, and also for being available to provide even that support in terms of implementation. So thanks everybody. And back to you, Dr. Talkmore.
Thank you very much, Mr. Ndlovu, for officially launching our GIS lab mapping framework. The link has been provided in the chat box. You can also go to the Africa CDC website. You'll be able to access this link. So thank you very much for that. So colleagues, as we come to the end and we conclude today's very informative and important and a milestone, as Mr. Ndlovu said. We would like to thank everyone for participating in this launch of the GIS framework. And as you have seen from the speakers, our invited guests, from the presentations, this represents a key and major milestone in our Africa's journey towards building what we'd like to see, which is a resilient and, most important, a data-driven and interconnected lab networks that can effectively work within our prevention, detection, and response interventions to those threats that we're always facing. So this framework, in which the development was led by Africa CDC, working with its regional partners, including ASLM and member states. And you have seen that how this has followed a very intensive regional consultative process that began way back in 2018, culminating in the framework today. And I think at the core is presented by Mr. Tapson. At the core of this framework, it really seeks to achieve two very important strategic objectives that he highlighted. One, to expand this geospatial mapping of lab capacity across the continent. 5,000 labs is almost just a drop in the ocean. Some countries that are here actually have more than 5,000 labs as just one country. So you can imagine if you try to multiply that by 55 countries. So there's still a lot that needs to be done. And this framework will really work towards one of its main strategic goals is to expand that mapping. So we're calling upon you as countries to adopt this framework, adapt it in the way that suits your systems and network so that we can map more and more laboratories for us to understand. The second objective is highlighted by Mr. Tapson is really to increase the utilization of that data that we are collecting. It's of no use just to have data, but it's important that this data informs our decision making. It informs our improvements. It tells us where are the diagnostic capacity gaps. It helps us to strengthen our surveillance systems as well as our response to outbreaks. I think also what is very important that I heard very clearly from this GIS mapping framework, it really seeks to integrate a One Health approach, which is very important. It promotes harmonization of different data systems. How can this be integrated to what you already have, like your DHIS, to the laboratory information systems that you have in the countries, so that we are not creating parallel mechanisms of data collection and data storage and utilization. So it's integration into a One Health platform and connecting to your existing system is a very important area to be able to do that. Thanks to Cameroon and Tunisia, they shared with us their journey for remote assessment and data collection. Tunisia illustrated how lab mapping is guiding them in terms of surveillance and diagnostic strengthening. And these examples really reinforce that this approach is not just a data exercise, but it can actually be a transformative tool for policy, for those that want to invest in our systems, and in aligning our functions, the functionalities of our lab networks with national as well as regional priorities. So I think before I hand over to Mr. Ndlovu to close this meeting, I think we are really calling upon all of you as member states to adopt and institutionalize this GIS lab mapping framework within your national laboratory strategic plans, within your resource mobilization plans, in your advocates plans. So let us continue to work together. We are here as partners, the governments, as well as technical experts that are there as we transform or as we turn data into action. So thank you very much for listening and following. And at this moment, I would like to call upon Mr. Ndlovu to officially close this meeting. Over to you, Mr. Ndlovu.
Thank you so much, Dr. Talkmore. I won't take much time. I see we are already behind time. So Just to say, a lot has been said, and I really want to appreciate the presenters, the countries that really have shared their experiences. And I'm really encouraged also to see that more than 29 countries are already undertaking this lab mapping exercise. So that is very positive and encouraging for the continent. So two things for me, which I would like to reiterate. Number one, let's continue to expand this lab mapping exercise. We want to see country ownership. We want to see country leadership. This is our program. This is your program. So we want to see the countries taking the leadership. ASLM always stands ready to support, and I'm sure even Africa CDC is also available to provide that support. And finally, data utilization. All this information that we are collecting, we need to demonstrate that we are using it. We are using it to inform our programs, to inform our decisions. I think this is the value that we will be looking for moving forward. So thank you so much. We are looking forward to a time where countries really are putting together this information. They're utilizing this information to inform even some of your submissions, your proposals, and so forth. So thank you so much. At this point, I would like to declare this meeting over. Thank you so much, and have a wonderful rest of your day.
Thank you very much. Merci beaucoup and obrigado.